Thanks, Jacoby. So briefly, prior to the pandemic, I direct the Environmental Health Bureau in the department, and we spend our time working on food safety issues and food health, on issues related to environmental factors that cause harm to people. And so we are about keeping people safe through regulation, through education. We have an injury prevention program that works on injury prevention issues, including violence and sexual assault prevention. And we have a program that tries to keep people safe and healthy through healthy homes, including lead safety, asthma, improvement in asthma outcomes, and all of those things that are tied in some ways to the physical, chemical, and in some cases, social environment of the state of Maryland. That's our job, and that's what I've spent a good deal of my professional career working on, both at the department since 2006, and prior to that at Johns Hopkins at the School of Public Health, and then prior to that, a bunch of other places. COVID-19, as your last panel said, I think of it this way. When you have a system that's under stress and you add another stressor, all you do is magnify and clarify the existing stresses that are out there. That includes inequality. It includes all of the things that your panel talked about so eloquently. And there's no question but that as the Department of Health has tried to tackle the problems of COVID-19, what we've seen is that the pre-existing problems that already existed across Maryland and across the country and across the world are only made worse and exacerbated by COVID-19. So I can give you many, many examples because I've been working very much, my part of the COVID-19 response has been on business, environmental, higher education, and also correctional issues. And so I'm not going to spend any more time talking about any one of those. I'm sure we'll talk about them. But in each one of those, the underlying pattern has been that all of the inequity, all of the problems that already existed in those institutions and those settings because of racial, economic, educational, and other kinds of inequities have been magnified and have made the problems of addressing COVID-19 worse, and COVID-19 has made those problems worse. And we can talk more about those in detail.
Thank you, Cliff. Can we go to Dr. Brathwaite?
Good morning, thanks again. I think that we are moving from, in my work, we are moving from pandemic to pandemic, or I call it epidemic to epidemic and pandemic. In that for the chronic disease, that could be considered an epidemic. Cancer, diabetes, and even worldwide infant mortality. But before another pandemic, we were dealing with these conditions. And now you add one which is infectious. So from managing chronic conditions, now we have to manage infections, which to the ordinary person is more damaging than those chronic disease because it's a quick and it spreads faster. So I would say that during COVID, we have shifted a bit, but not completely shifted into COVID conditions because we still maintain funding. Prior to COVID, we had funding for motor grantees to deal with chronic disease and infant mortality and asthma. We continue to fund those community-based organizations and fair-based organizations. We continue to partner with Environmental Bureau with asthma. And so we have now added another dimension where there's more funding now because of the emergency condition. There's more funding for COVID-19. But I think that we continue to manage all of the epidemics that impact minority populations, but with a heavier load now on the COVID-19.
Thank you. Ms. Curtis, how has the pandemic impacted your work with the coalition?
I'm glad you asked that because it's I think that all of the speakers from the earlier panel, which was fantastic, I'm glad I logged in early to check out what was being said, because I think there's some heightened awareness that the COVID has sort of brought out more of what is going on. And for those of us who work in the public health space and population health space, I mean, we've been trying to get our seat at the table to do cross-sector coordination for a long time. And now people are forced to be in a situation where they have to recognize the impact that they have on health and how not only the EJ space, but all other aspects of our society are now impacted by a health crisis. So I think that what has happened with the coalition is people are amped up because they have ideas and they have concepts and policy recommendations that have sort of been on the back burner for a long time. And this gives us an opportunity as a coalition to push harder and to try to impact some transformative change. So, you know, you got to make lemonade. And in this kind of situation, I think the Healthcare Action Coalition, recognizing some of the inequities that occurred and were occurring and are occurring in Prince George's County pre-COVID, there's more of a reason for us to get amped up and push harder to try to work through that. So I'll leave it there because there'll be lots of opportunities to kind of shake out how people can get more involved and how the engagement of community leaders as well as residents can have some impact on what's going to happen in the future.
Okay, no, thank you for that. Councilmember Ivey, are you on?
I am. Thank you so much, Dr. Wilson, and I really appreciate you putting this on. And some of the comments that have been made, I mean, it's so true. COVID really has laid bare the economic, the health disparities, so many things happening in our communities. And in my area, in District 5 in Prince George's County, the flood has done even more to reveal so many issues going on. If you look at the building that's gone on in our communities for decades, for a long, long time, the more impervious surfaces you add, the fewer places water has to go. And then it ends up in people's basements, there's sewage, all kinds of things. And then of course, the insurance companies love to find little ways to avoid having to pay. And then you have people who are losing the their entire investment in for their whole life savings that they've had in their home is being wiped away by their house being destroyed. And without the support of the insurance that they thought that they had. So it's been a lot. One thing that it has really made me pay even more attention to is how we all need to be more thoughtful about how we develop, where we develop, and the stormwater management policies, the regulations that we currently have. They don't work when you have what they call a 100-year flood, right? But when we have 100-year events these days, they're not happening 100 years apart, not anymore. I mean, we have fires in California that are just unprecedented. You have floods here that are crazy. You look at Howard County, Ellicott City, you see the floods that have happened there where they said, oh, this won't happen again. And then a year or two later, it happens again. So yeah, it's a lot. And it's kind of, I feel a little demoralized today because of the death of Ruth Bader Ginsburg.
Mm-hmm.
You know, we all need to soldier on.
Yeah, thank you for that. Shocking. Really sad, shocking. Just turning the TV on. That's so soft last night. So, Ms. Margueritte, can you chime in, please?
Yeah, absolutely. Thank you for this opportunity. So I'm Christianne Margueritte. I'm an environmental justice scholar at heart. I received my bachelor's degree in environmental science and African American studies and my master's degree in environmental policy from the Johns Hopkins University. And then along with helping build our environmental justice campaign, I also run digital and communications for Progressive Maryland. And we are a racial, social, economic, and environmental justice statewide advocacy organization. So my work, first and foremost, entails protecting Maryland's working class families and communities of color. Most recently, I was working to urge our Maryland General Assembly to reconvene for a special session in order to pass legislation for rent and housing relief and emergency workers protections like hazard pay. Even with the new CDC moratorium on evictions, which is a great example, first of all, of how housing and healthcare are intertwined, like we're talking here about all these interconnected issues. Still under those guidelines, there are almost 300,000 Marylanders at risk of evictions from losing their job due to COVID and no longer being able to afford their rent. So people can't wait until the legislation reconvenes in January. So I've been calling on leadership to provide relief now, since being homeless, as we know, especially during a public health crisis, can be a life or death situation for too many. And then aside from public health policy, we've also been pushing strongly for police reform statewide as part of our demands for racial justice in order to protect Maryland's Black communities from too often tragically fatal police violence. So here in Prince George's, a predominantly Black county, as we know, we were instrumental in inspiring County Executive Brooks to create the Police Reform Workgroup, and multiple of our Progressive Maryland members have been selected to be part of that workgroup. We're also actively working with parents and advocates during this time to get police out of our county public schools and securing more counselors to replace the cops. And then speaking of schools, lastly, I'll just note that we also led a highly successful 2020 census campaign amidst the pandemic in partnership with the county, targeting Prince George's because it is one of the two areas of our state with historically the lowest census response rates, along with Baltimore City. And so we actually reached over 50,000 residents in Prince George's alone, urging them to complete the census so we can ensure that our communities are provided with the resources they deserve in order to bounce back from these long-term financial consequences that this pandemic will have on our communities. So I'll leave that there, and thank you all for having me join you today.
Oh, thank you, everyone. Our next question is honing in on some of the numbers, morbidity and mortality in the county. So we had a question that we wrote July 7th that said, as of July 7th, Prince George's County reported 19,000 cases, surpassing the COVID-19 case numbers of 20 U.S. states. Today is not 19,000. That number today is, I think, 28,737 cases, 817 deaths in the county. To what do you attribute these sort of numbers to? And I want to start with Dr. Brathwaite first.
Numbers. Some people say you have numbers and you have statistics and damn numbers. What do these numbers tell us? Numbers of cases, but they all tell us about people. They're people who are severely impacted in terms of their health, and they're people who are dying. And when we ask for the explanation, why are these things occurring in a county like Prince George's, which has possibly the highest wealth in the state in terms of a predominantly Black county, why? There are a number of explanations that have been provided. And one is that when you look at the numbers and the people who are affected by those numbers, the cases, frontline workers, those are the largest component of individuals who are severely impacted. The second would be based on underlying health conditions. I know that there have been some discussions about the underlying health conditions, which indicates that if these underlying health conditions were treated properly by the healthcare system, you would have better control of diabetes, better control of obesity, better control of cancer, and so on. But that's the second reason given for the numbers. The frontline workers, the underlying conditions. And then the third reason that indicate that we look beyond now to external factors, such as the underlying pre-existing structural and racial conditions. So that when we look at housing conditions in certain zip codes, because in Prince George's County, these numbers reflect what is happening in the top 5 zip codes in Prince George's County. Those 5 tops, there are 10 within the state that we consider to be highest. 5 of those centers are in Prince George's County, 4 in Montgomery County, and then we have 1 in Baltimore City. So within Prince George's County, those 5 give us the highest numbers. And we indicate that within those 5 zip code hotspots, there are underlying structural conditions, housing, that are big explainers of that, and the types of jobs that those 5 zip code workers are involved with. So when we look at the numbers for Prince George's County, we look at the top zip codes, and we also look at the explanations, which are the top 3 explanations in terms of the worker force, who are not able to protect themselves, who have to be out there in the public, the underlying health conditions, and the third would be the underlying racial, socioeconomic, structural conditions.
Oh, thank you. Cliff, can you jump in on that and add to that? Anything to add to that?
Yeah, so thank you. I don't want to repeat what Noel just talked about. I want to talk instead a little bit about some of the issues that I think are also at work here, which are more challenging because they reflect in some ways, at least as I understand it, some of the challenge of communication, trust, leadership, and alienation between what your last panel talked about as messages from the top, and then how those messages are understood by people who are in the communities themselves. And let me just give you an example of two of those. The first is the issue of masking and social distancing and all the recommendations that, as a government bureaucrat, which is what I am, we have tried to convey to people is the biology of COVID-19. And that biology is not completely understood, but one of the things we're pretty clear about is the farther you away from other people and the less you do, the less you are in crowded conditions and the more you use facial coverings, at least at this point, that seems to be one of the most important ways of protecting yourselves. One of the challenges that we've had is clearly not everybody understands that message the same way, not everybody believes that message the same way, and the disinformation that has come out in many ways and the way that messaging has been perverted and in some cases intentionally misused, as well as the way communities understand that, has led to some of the challenges that we've had. So 2 examples of that. We know that, and this is not true just in Prince George's County, but elsewhere, there are certain parts of the community that have intentionally decided that large parties, big group events are things that at this point, both they want to enjoy and appreciate, and that's been a challenge in terms of thinking about how we continue to message that and continue to have people understand that continues to be important. Secondly, vaccine, and I want to touch on vaccine here because I think it's really important. We do not know the extent to which vaccines are going to work in all people the same way. If you look at the historic distrust that communities of color, communities that have been experimented upon, and communities that have intentionally, in many cases, been used as either test subjects or subjects where we need to know or think that has been a convenient way of testing communities in correctional institutions and elsewhere. How do we effectively understand where and whether vaccines that are under development are going to work in people in whom the rates are the highest? The only way we're going to know that is by actually having those people participate in vaccine trials. But the same people are in some cases suspicious of participating in what they view as experiments or vaccine trials. So that kind of distrust and lack of honest communication historically is one of the things that I think is really important to understand and to be able to state frankly. We will never be able to address those problems unless we can have open, honest communications and admissions of where we have failed historically and how we move forward to address those inequities.
No, really important points, and some of those points will be raised and discussed in one of the next sessions on medical mistrust. And so then let's hear from Councilmember Ivey on this, like the numbers. What's happening? What do you see happening in your ward, your district?
Yes, I'm a little more conservative when it comes to how quickly I believe we should be opening. And even though our county has certainly gone slower than the rest of the state, for the most part, I believe Montgomery County's pretty much in step with us. I still don't think that we should be opening at all yet. I mean, according to the CDC, the guidelines say that you should be under 5% positivity rate before you begin to reopen. And we are not below 5%. I mean, if you look at the numbers that the county uses, we're at 5.5% for our positivity rate. And you know, I believe that when you look at how Johns Hopkins University has done their numbers, we would be much higher than that. And then when you look at our infection rate, the spread, how many people will get it from one person, we're above a 1-to-1. So we're at 1.07, I believe. And that means that more than one person will get it from me if I have it. And as long as you're having it more than one person getting it, you're going to have increasing numbers. I mean, that's just clear. So I'm a little more paranoid perhaps, or conservative, depending on how you look at it. I'm not conservative in much, but I'm certainly conservative in this area. So I believe that opening is being rushed, and I understand, you know, we're all worried about people having jobs, and I'm worried about that too. I spend a lot of times in my day-to-day life these days feeding people, and also giving out masks. I have volunteers who make masks. If anybody out there wants to help make masks, I could really use some help. And we give them out at food giveaways. So I see the need, and I'm very concerned right now about undocumented immigrants, because they don't get the same protections. They don't get the financial support. They don't qualify for unemployment or for the housing protections. The things that the federal government's doing right now, where you have to go online, fill out a form, print it out, and give it to your landlord. Well, even if you did all that as an undocumented immigrant, because of what's on that form, you're not going to qualify. Mm-hmm. It's tough out there, and I believe we're going to see just a tsunami of evictions that we haven't seen maybe ever, you know, between the renters who are having issues and then people who are going to go under and foreclose on their homes. I mean, I'm not feeling very optimistic today. I'm sorry. I feel like I'm bringing negative energy to the group, but
no, you're fine. No,
yeah,
I'm
pretty discouraged at this moment, and I feel like the governor is not doing more. He's not doing what he needs to do. The legislature is, you know, as Christianne was just pointing out, is not having a special session. When I was in the legislature, we had special sessions to raise taxes, to approve casinos. To me, this is more serious. You know, when you look at what's going on in housing prices, when you look at what's going on with, you know, the police issues, the things that we need to take on right now, what more are we going to wait for? I mean, you're going to wait till January for what? So that we're not going to have more money then? I mean, I don't think it matters who is president as far, I mean, it matters deeply to me who's president, but as far as what Maryland does about these issues, it doesn't matter. We need to take action now. So you know, I'm just not feeling all of that energized at the moment, but I know I'm going to feel better. One thing that did help me was reading in the paper about the turnout at the polls yesterday for the first day of early voting in Virginia, and it sounds like mostly Democrats were coming out. So I'm hoping that that continues across the country.
No, thank you for that. We gotta, like we said in this last session, you gotta vote like life depends on it. So I think that what you just said is very positive, and I think that's something for us to think about. We can all vote. I want to go to Miss Margueritte again on this question.
I'd like to just interject for a second and apologize. For the first time since the pandemic, I lost Wi-Fi. So I'm now back and on my phone. I missed the last question, but I'm here to catch up.
Oh, you're fine. I'm gonna come to you after Miss Marguerite. So I'll repeat the question. Basically, I gave the numbers of where we are right now with the number of cases and deaths in the county, and we're at like 28,000 cases. And the question is, how do we get here? Why do we have so many cases in our county? Let me go to Miss Marguerite first. Back to you, Miss Curtis.
Sure.
So,
go ahead, Ms. Marguerite.
thanks. So first I'll say to Council Member Ivey quickly, I feel you on that disappointment. So I'm right there with you on that. And I'll echo what the rest of my colleagues have said so far about how this leads back to structural and systemic racism and inequities. You know, the majority of COVID deaths across the US as a whole are folks of color, with 73% of all children in the US who have died from COVID so far being Black and Latinx. And we know that this is due to wealth gaps, food and housing insecurity, all things that still very much exist in Prince George's. I mean, if we're seeing that folks are unable to pay their rent, then how can they pay for medicine and hospital bills, et cetera? Systemic racism has been the driving force behind the disproportionate rates of infections, hospitalizations, and deaths. And just some of the factors are income inequality, inequity in access to healthcare, and adequate housing with plumbing to even wash your hands, access to hand sanitizer to take with you everywhere you go, a safe and clean work environment, which is maybe where you spend most of your waking hours, and then access to safe transportation that's physically distant to get to and from work, access to sick leave if you need to stay home, and I could go on and on with that. 41% of our frontline workers are Black and non-Black people of color. And these are your folks who have increased risk of exposure to the virus already. And then on top of that, these largely Black, Latinx, Indigenous, and Asian populations who have less access to quality healthcare are the ones who need it the most, because they're putting their lives on the line every single day. Some still don't even have adequate PPE or access to testing. So I'll just reiterate what Dr. Mitchell already said, the comments on testing and vaccines. We need greater access to both of those, but especially free rapid test results statewide. I know that our test results here in Maryland, our labs are backed up. Sometimes it takes folks almost 2 weeks to get their results back. And in that time, they're still going to work, and they can be asymptomatic carriers. So that is not okay. Furthermore, many of our essential workers live in densely populated areas. Like Prince George's County has many densely populated areas. It's a large county with almost 900,000 residents. It is the second largest county in our state, aside from Montgomery County. And so many members of these Black and non-Black communities of color might find it difficult to practice physical distancing in the first place, like I said, with transportation to and from work, but also if they have families that they're coming home to, or being forced to be around people in close conditions on their job. And also Black and brown families are more likely to live in multi-generational households than their white counterparts. So due to both cultural reasons and also along with the cost of senior care living. So that leaves the very most vulnerable of our population, which is low income, older folks of color, at even greater risk on top of all of this. And really quickly, I'll just say, I know that Dr. Mitchell already touched on this, but something else that Progressive Maryland is really pushing for is reform for is prison reform. So one of our most at-risk populations, again, for COVID-19 is our incarcerated community members. And we know the virus spreads more rampantly in prisons. We don't have adequate systems in place to protect those populations. And of course, again, this links back to those people being largely Black and brown people due to over-policing of our Black and brown communities. So all of this is, interconnected, and it really all just stacks up one upon another. And this is just a reality that we know all too well here in Prince George's County.
Well, thank you. Ms. Curtis, can you chime in a little bit on that question, like the why? I think maybe many folks have already covered it. Do you have anything new to add to this part of the discussion?
Actually, no. I mean, I think everybody hit it. I mean, we have some serious challenges, and the reasons why these numbers are like they are, I think we hit on every one. I think the challenge also is resources, and I don't know if anybody talked about resources, but
yeah.
the county does really suffer. While I was out, somebody might have mentioned the inequities in terms of the distribution of resources towards health and human services and these other things that could be. So I'll just pick up from your next question. And
yeah, I'm gonna give you the next question. So I'm gonna go with you first in this next question. It's gonna follow up on this previous question. So we have this county, and this is, to me, is just a multiple shocking stats or intersections. So this county is population 86% people of color. Okay. Now we are known, and I'm gonna push back on this. We are lauded, and people in our political body politic say we're the wealthiest county, majority Black county in the country. Okay. And I scoff at that, because you've had real wealth, you wouldn't have the disparities that we had pre-COVID-19. So I want you to dig into that, Ms. Curtis, first. Why do we see these disparities? Dr. Brathwaite mentioned we have 5 zip codes that have some of the highest morbidity rates in the cases for COVID-19 in the state. Why do we have all these racial disparities? Why do we have these disparities when we're supposedly the wealthiest majority Black county in the country? I would stop saying that, folks. If you shouldn't say that, because your wealth is not leading to real health. So I get really irritated when I hear people saying it. But go ahead, I'm gonna be quiet. Go ahead, Ms. Curtis.
Well, I agree with you. I don't think wealth is associated with good health. I mean, if they're Black and they're African American, we know for sure that a lot of these people are suffering from the same health disparities that are plaguing others. I think that there's some significant inequities here, and there are large pockets of poverty throughout the county. And sometimes I think this metric, and I agree with you, impacts whether or not people believe that resources should be poured into Prince George's County. And that's the part that I think you and I share in terms of the data around the wealth in the county really has significantly impacted how resources are dispersed. There's a lot of perceptions about how much wealth is in Prince George's County, and funding streams and philanthropy and other people are not attracted to funding a place that is touted to be wealthy. And it's really unfortunate. I mean, the amount of the budget that is allocated for health and human services in Prince George's County is 1% of the total budget of the county. And in Montgomery County and in Baltimore County, I believe, Fairfax County for sure, it's like 10% of the budget. So why is it that, this metric is making people feel that, there's gold and then there are hills? It's not true. And we also have a lot of data in our system by zip codes showing where some of the health disparities are in terms of diabetes and high blood pressure, hypertension, and the Black folk with money are still plagued by some of these health challenges. And so, money don't make you absent of some of these things when there's other factors that are included in this.
No, thank
If,
you.
if I
Thank you
could
for that.
jump in just.
I was going to you next. Go ahead. You're up
Thank
next.
you,
Go ahead.
because I actually get really irritated when people talk about, you know, how wealthy Prince George's is, because number one, it's not true, right? What they're really saying is if you take other jurisdictions with a lot of Black people, then we may have more, but you're already starting out way below the line. So we're in the DMV, and I can tell you that the budget of Prince George's County in a good year is about a quarter of what DC's is, okay? DC's normally is like $16 billion. Ours is $4 billion, and we have a third more people. They have 100,000 people. We have 900,000 people, more than that. So we have a third more people, a quarter of the budget. Come on, a lot more land mass to take care of. Montgomery County has $8 billion budget. So they just have more money. And when you talk about the shortage of money that goes to health and human services, social services, it's true. We don't fund it the way that I wish that we were. And I won't say that I think that we don't fund it the way we could. I can't even tell you what we could do right now. Right, we can't possibly do more of anything because we're just trying to hang on by our fingernails with this pandemic. If you look at just a normal year, if you look at last year and the small amount of money that goes to health and human services and social services, you look at the small amount of money that goes to help people who have disabilities, it's hard. I mean, I do wish we were doing more, and it's all about priorities. And you know, I think as a county, we need to try to do all that we can. I was part of the effort to keep from increasing our property taxes recently. You know, over the summer, there was an effort to put something on the ballot that, had it passed, would have led to a property tax increase. I'm not saying we don't need the money. We totally need the money. I just don't think it should come from the homeowners right now. Homeowners are just really financially stressed as it is. So we have to find other ways to bring in money. But to pretend that Prince George's County is a wealthy jurisdiction is just not true. We're not wealthy. So, you know, that word just needs to stop coming out of our description.
Thank you.
Can I add something here?
Yeah, yes, sir. Go ahead.
I think it's true. I mean, we cannot Prince George's County because it is the wealthiest. I think we should acknowledge that. It is the wealthiest. And that being proud of, I mean, I lived in Prince George's County for many years. I went to school at University of Maryland. So I think we should be proud that Prince George's County is considered economically a wealthy county. But here's the other caveat, is the distribution. How is that wealth distributed in Prince George's County? You find that you can live next door to a wealthy zip code, and next door to that wealthy zip code is a poor zip code. And you can have some of the same health outcomes in the wealthy zip codes that you have in the poor income zip codes. So wealth is health. I mean, wealth is an indicator of health, but it's not the only predictor of health. What is taking place in the other parts of Prince George's County that need to be concerned about would be the distribution of the budget in healthcare. Prince George's County has possibly one of the least accessible healthcare systems in that part of Maryland. Montgomery County has a better healthcare system than Prince George's County. Now, Prince George's County is trying to build with the University of Maryland another hospital. So you have to look at beyond the wealth, which is commendable, to the other resources that promote health. And one of the other things that promote health is the presence of community health facilities. And that is absent, and that's a challenge in Prince George's County. So I think on the one hand, you commend it for the wealth. On the other hand, you said, we must conclude that there are other things that are driving these numbers, even in a wealthy county, because you do have pockets of poverty You do have instances of crowded households which are exacerbating the problem of health. So I think we should commend, but at the same time, we should recognize that there are issues that need to be addressed in Prince George's County. So I do not do well. I applaud them for the well, but the other things that need to be addressed to bring better health outcomes to those who are less healthy and those who are in poverty situations in different zip codes of Prince George's County.
So just want to chime in real quick before we keep going. We're getting low on time. I'm probably take us up to the hour, right? So we have 12 minutes left. So you're talking about infrastructure disparities. Shari mentioned it. So access to healthcare.
Right.
You talked about how much money is invested in the healthcare system. We talked about food. We have food apartheid in our county. We talk about food deserts and food swamps. Those are symptoms. We have structural food issues. We have issues with energy poverty in our county. We have issues with affordable housing problems in our county. We have overcrowded housing in our county. Look at zip codes, Bladensburg zip codes compared to Bowie zip codes. I live in a food oasis in Bowie. I can be at home right now with y'all, talking to y'all. There are folks who got to go work today, right? Who could be exposed to the virus, okay? So I want to go to Cliff next. So I want to be quiet. We have 11 minutes left. So I want to speed this up. So Cliff, can you quickly, what are some of the things, the reasons why? And then also, can you talk about solution too, as we move in this panel?
Yeah, there's been an interesting side conversation about some of my earlier remarks, and I think thank you, Shakobi, for that, because I think Prince George's County has specific historical problems that magnify everything that we've talked about and continue to do so. And so part of the solution is recognizing that and addressing that in the context of solutions that come forward. Part of it is recognizing Prince George's as part of the state and recognizing that it is in some ways a microcosm for many of the issues that we have historically had in this country and in this state, and thinking about that if we can't address them in Prince George's County, we can't address them anywhere. So I think for us and for the state and for the health department, we have looked at the challenges of the National Capital Region and Prince George's County in particular as part of the National Capital Region, and thought about what are the kinds of things that we can do to bring services and help people create their own services and their own issues there. So with respect to legislative policy issues and sort of that issue, I can't speak officially about those because those belong to the legislature and not me. Clearly, from an individual point of view, I think it's incredibly important that as policy leaders and as a government and as a people, we understand the historical context of everything that has happened in Prince George's County and address that as part of our solutions. From a bureaucratic point of view, there are programs that we have in the state that need to be very much part of the community. And one of the things that I think we have not done well and have been challenged to do, both geographically, politically, racially, and economically, is to allow the local communities that are most affected to drive the agenda. That what we create, when we have government programs, we tend to create them from our own bubble and our own tower. The thing that we have not done well is allow local communities to drive the agenda and to put them in charge of both the agenda and the questions and the subsequent development of solutions. So I think one of the challenges that we have, one of the things that we need to do better, Dr. Brathwaite has his minority organizations and technical assistance organizations that are community driven. We need more of those, and we need more of those to be able to link from the local community to programs like vaccines, to programs like the health department infrastructure. If we don't do that, frankly, we are not going to succeed, because as a state health department and as a state bureaucracy, it's very difficult for us to conceive of and implement programs that work in local communities unless they're driven by local communities.
I so totally agree with that. Yeah.
Thank you for that.
Totally agree.
Let's go with.
There's got to be real.
One thing, though, I think that we need to keep in mind, though, that the state has such a strong role in what happens locally. I mean, I understand what you're saying. It sounds good. But look at something like medical cannabis. Our communities have been locked out of that industry, and it seems intentional. And I don't know if it's so much let's lock out Black people. It is let's take our friends. Let's make sure our friends, and our friends are all the wealthy white people, get access to the to those licenses to be able to open up. So it's a problem. Like we're being locked out of it financially. And right now, while it's medical, and then a few years from now, whenever it does finally open up recreationally, you're going to have all the people who have suffered under from criminal justice when it comes to marijuana are not going to be allowed to take part in you know, a lot of these people have been entrepreneurs for years. It just depends on how you look at it, right? But they're not going to be able to build on their experience because they've been breaking the law until we change the law, and then you'll have a whole different group of people who will benefit from it. So I think that we need to be honest about that. And, you know, health, when you all talk about health and wealth and connections there, the people who need to be benefiting from that industry right now are not, and it doesn't look like we will in the future.
Well, thank you for that. I'm gonna go to Ms. Curtis next, because we're basically this is kind of the closeout. I'm not sure we're gonna get into any questions from the but hopefully we would maybe get one question. But Ms. Curtis, can you go ahead and
I think, yeah. Our coalition, the Prince George's Healthcare Action Coalition, has a health equity work group, free document, which I will share with you after the call and you can distribute. And I think what you're doing here is you're encouraging truth telling.
Oh, we're losing you a little bit.
The truth, we need to be engaged more in. We need to be engaged more in some constructive discomfort. Did you hear that?
Yes, go ahead. Yep.
And yeah, we got to get a robust realignment of resources. You don't always need more money. You need to look at where you're spending money and see if you do some more cross-sector collaboration and people look on the table and see what they have in their coffers, some of that can be realigned. And if we strengthen the nonprofit sector and do a lot of what Cliff was just talking about, get more community engagement and do more community advocacy, but they have to be trained. We have to give them the tools so they know how to be their own best advocates. We can't just expect the community to tell us what they need. We need to be able to help them identify where the gaps are, identify where the inequities are, and then make some informed decisions about how they're going to transform the way their communities are handled. I mean, this is really a time to look at increasing more health impact assessments. More funding has got to go into that, and they need to have teeth. The health impact assessments can't just be a report and a piece of paper. They have to have teeth, and they have to be able to hold agencies accountable for making sure that they implement health and all policies across the board. And that's how we do it. And it's got to be done. On my last thing, we have to institutionalize an equity lens.
Yes. Thank you.
We got to blow some stuff up and change protests into policy. We can't be mad about it anymore. We got to change it. We got to fix it.
Yeah, I appreciate that last point, and I'm gonna go to Miss Margueritte next. But you're really important. Equity lens in all the counties programs and policies, county passing real teeth health impact assessment, and of course, we can talk about the problems of the current health impact assessment framework within the county, and then health in all policies. Has the county council? This is not a really question; it's more rhetorical. This is for us to talk about later. Constructive, as I just said, constructive kind of tension and discomfort. Has the county council looked at health in all policies? Has the executive looked at health in all policies? Has our joint planning department, land use, talked about health and land use and health in all policies? Really important points, because zoning is part of the problem. Infrastructure investments part of the problem, and making sure the community speaks with its own voice. That's what y'all saying is part of the problem. So that can also be the solutions, as y'all are all saying. I'm gonna go to Ms.
And I am encouraged right now that the conversations are happening. The pandemic has triggered it, and I will tell you that there are some real interest at the Board of Health level and at the county executives level to start looking at the health and all policies and equity piece. So it is happening.
Okay, thank you for that.
Goodness.
So lightning responses from the last two speakers. And just to go back real quick to the health and all policies piece, we did have a statewide health and all policies commission, right? So that work is out there to be leveraged by the county. Go ahead, Ms. Margueritte, and then we're going to end with Dr. Brathwaite.
I just want to build on that by saying that another solution is that we need to support Black doctors, because we know that it has statistically been proven that Black doctors provide their Black patients with the adequate healthcare attention and care that they deserve. So just retweet everything that my colleagues have said. And I did see a comment about land use. Is it okay if I talk a little bit about that as a symptom, talking about environmental toxins? Is it okay if I dive into that really quickly?
Yeah, I'm gonna give you 30 seconds.
Okay.
Environmental injustice, go ahead.
All right, well, 30 seconds. I just wanted to say that we already know that communities of color are disproportionately impacted by climate change and environmental hazards like toxins and pollutants, because waste entities like garbage dumps and trash incinerators, along with polluting energy factories, are often too purposefully placed in low-income neighborhoods and communities of color like Prince George's County. And in Prince George's, we see that there is already, it's home to multiple landfills and trash incinerators, and the government and large corporations are constantly trying to input even new ones, which comes at no surprise. But we can't let them happen. We can't let them continue to dump their trash in the backyard of Black people. It causes a myriad of negative health impacts like asthma and other respiratory illnesses, which lead to symptoms that could also potentially be leading to these higher rates of COVID-19 cases in the county. So there's so much more I wanted to say on that, but I'll just leave that at that for now.
So very important point. We know that trapped air pollution is a risk factor for COVID-19 morbidity. So I appreciate that point, and you have the floor. Quick lightning, Dr. Brathwaite.
Well, over the next 2 years, because we say, what can we do over the next 2 years? I think that we are going to develop a stronger partnership with Prince George's County from our health department. We are continuing to fund at least 5 to 6 community-based organizations this year and also next fiscal year. We have provided from the ground up, we have provided the local health department with some relief packages for COVID-19. And over the next 2 years, we'll continue to build on the partnership between Prince George's County and our office to demonstrate how a partnership between the local health department and the community-based organizations and faith-based organizations in Montgomery County, in Prince George's County, can not only address COVID, but also the underlying factors, the underlying health factors, and the underlying structural factors. So we have that 2-year window now that we are working on to bring some real changes in Prince George's County.
Thank you. Great panel. I appreciate always want to end on solutions, right? And so I think, as Shari mentioned, there's some things that have already been done. Councilmember Ivey mentioned there's things they're doing. We need to really work together. And I want to give this panel a round of applause for the great comments. And I want to see this panel working together to make things happen within the county. So these are just not panels for us to just do talking. we got to do some walking and and be about the action. So thank you again. And for the audience, if you have questions, send your questions to the panelists. I'm sorry we won't have time. We're just kind of going real tight and fast with these sessions, and we're running a little bit behind. We're going to start around, I think, 12:10 for the next session, just to give people time for a little bit of a break. So you have a bio break, quick food break, get that little energy bar if you need it.
Dr. Wilson,
Yes.
Wilson, because my internet went out and I'm on my phone and I couldn't share any slides, I do want to encourage people to consider being a part of the Prince George's Healthcare Action Coalition.
Can you send us the information? We can put it out on the through the chat.
I will.
And Shakobi,
Yes, go ahead.
this is Cliff. And for people who need or want to get in touch with me regarding environmental health issues or anything else related to COVID, it's cliff.mitchell@maryland.gov. Maryland spelled out. So I welcome all of your comments.
And to Shari.
Cliff.mitchell@maryland.gov.
And to Ms. Curtis, please send me some information. I'd like to be a part of that coalition.
Thank you very much. I think Dr. Carter would appreciate that.
Thank you, everybody. If you want to, other members of the panel, put your information also in the chat, so the attendees who want to ask you questions, who want to collaborate with you, we can make that happen. Let's make that happen.
Absolutely. Thank you, everyone.
Thank you, everybody.
Thank you.